Let's continue with the last topic of the unit, like the over the counter drug, or you can say over the counter sale. So, the OTC medicines are those medications that can be obtained over the counter or from the chemist bench without the prescription of the RMP and consultation with a physician. So, these are the safer medicines, and any of the patient can take it from the pharmacist. So it can suggest that those having a little significant pharmacological activity, and therefore the physician needs not to be very much concerned about these use by the patient themselves. So they are terms of OTC drugs. It is used primarily for symptomatic relief and not as a substitute for the prescription, like your headache, toothache, or some pains. So it is used primarily by for symptomatic relief. So the OTC drugs history is about, like, it started in the 1860s. The preparation of remedies at home is started and was replaced by purchasing of patient medicines. And by 1905, the market of the patent drug was at its peak. Further moving in 1920, due to intense economical and political struggle, changed the reference preferences care, resulted in decline in the public demand and the use of the patient medicines. So the OTC considered as a time-saving medications, and some patients do not want to spend much time at the physician clinic and do not have to time to spent on the physician clinic in the waiting, so the lesser number of side effects compared to the prescription medicines. If we concern about the medications, why OTC medications, what are the reasons behind that? Because there are very shortage of time and comfort, like the people in the cities and the towns, due to their busy schedule, don't get a proper time for visiting the physician time to time and proper getting the medication. But the OTC medication are having a less time, and they can consume it easily while taking it from any of the pharmacist or from the pharmacy. And these OTC drugs are much cheaper in the prices, like in our country, like India, where more than 55% of the total population is just near the poverty line. And the people majority are weak to visit the physician for small health problems, and hence prefer non-prescribed drugs comparatively cheaper. So next reason is about the availability, because most of the narcotic drugs are not easily available at all places. So due to the availability, there is easily preferred by the common people for daily health problems. Next is the level of literacy and the awareness of the patient. Many of the people have their very low awareness, due to which they don't prefer to visit the physician. And next reason is the self care. Nowadays, people are much more literate and aware about their body, and they are well versed with many of the terms, medicological terms, by reading it on the Google. And this is because of the self-caring people, that they can take care of their own. Next is the advertisement. So OTC drugs, mostly OTC drugs are being shown in the advertisements on the TV televisions. So most of the OTC medication producing industry give attractive advertisement for the increasing the purchase of the medicines. And also people, due to previous experience or due to the experience of the people, they take the OTC medicines. So, what are the significances? Like, OTC medicines are comparatively cheaper, and because of the poverty in the area, and also the people favor non-prescription drugs is the one significance. And the chemistry himself may prescribe the non-prescription drug, and this is very common in India. An increased trend for self-care and increased tendency of the patients maintain their own health. Next is the what are the advantage, like it will outweigh the risk and low the misuse and the abuse potentials. Consumers are able to self diagnose, treat and manage adequately labeled and health practitioners are not needed. What are the disadvantage of the OTC drugs? Like it will reduce the opportunity to receive the counseling about possible lifestyle therapies like exercise, diets. By OTC drugs, they are just taking it, but they don't know the about the backward monitoring parameters. Next disadvantage is the poor compliance. Misdiagnosis, patients won't benefit from the drug but will be exposed to its risk. More difficult to study the drug's effects. So these are the disadvantage. And so due to this disadvantage, they will lead to some of the risk, like they will, because of the self diagnosis and self medication, it will lead to a incorrect self diagnosis, which will delay in the diagnosis as well as the treatment if the patient is serious, and it will also lead to a hospitalization, and it will be a life threatening event also. So increased risk of drug interactions. And next risk is the adverse drug reactions, because the patients are taking it on, so there is no one to take care of the adverse event and the monitoring. So some of the class of the OTC drug has been listed here, like analgesic, antibiotics, cough suppressants, anti-acne drugs, NSAIDs, decongestants, antacids, antifungal or antibacterial. Like most of the local infections, you are taking antifungal, antihistamines, smoking cessation drugs, and many more. With respect to the OTC drug, there is a most important about the rational use of the drug. So, it is very important that the drug should be used properly, correctly, and in a lowest cost. So, the rational use of medicines refers to the correct, proper, and appropriate use of medicines, and the rational use requires that the patient receive the appropriate medicines in the proper dose for an adequate period of time and at the lowest cost, and use as an appropriate, efficacious, safe, and cost effective drug given for the right indication in the right dose and formulation at right intervals and for the right duration of the time. So the rational use of common over-the-counter medications are like the cough remedies like dextromethorphan, which is a cold suppressant which is present in the OTC cold remedies. It can be mixed with other drugs like histamines and acetaminophen. When children take these combined drugs without the prescription of a doctor, it may develop more serious health problems. It can cause asthmatic attack also. Like you can see the aspirin, so it is a type of drug classified as non-steroidal drugs or NSAIDs, which is used as a painkiller, but too much can cause a stomach bleeding. This risk increase in the people who are over the 60 year of age, are taking the prescription blood thinners, are taking steroids, have a history of stomach bleeding or ulcers, or have other bleeding problems. Use of NSAIDs can also cause the kidney damage, and this risk may increase in the people who are over 60 years of age, are taking a diuretic, a drug that increases the excretion of the urine, have high blood pressure, heart disease, or pre existing kidney disease. Some of the opioid drugs, like the codeine, this will lead to the drowsiness, and after taking this drug, do not drive or use the machinery that may injure you, especially when you first start the medication. So, the dose of an opioids pain medication that is safe for you could be high enough to cause an overdose and death in someone else, especially in the children. Next are the diet pills. So most women are body figure conscious. To achieve their ideal figure, diet pills may be abused or the fast result. So there are the misuse and abuse of the OTC drugs, and the list of these drugs is being listed here. So what type of product, solvent like propellant, chemicals, opioids, or laxatives, and related to the examples. So the abuse is most common in the adolescent, which is of age group of about 10 to 17 years, because they are very eager to check whether what is causes, and you can say codeine with them. Codeine is a most abusive drug is being used by the students or the adolescents which are very young in the age, and adolescents are 18% times more likely to die from an OTC overdose than from a illicit drug overdose. So it is very important to check, take care of that problem also. And in one survey it has been found that only 16% read the entire product label, how to take, what is the method, when to take. So this will lead to the misuse, and it then this misuse can cause abuse of the drugs. So it is very important to read all the follow up of all the directions which has been written in the label.